Your feet could be warning you about diabetes right now, and you'd have no idea. No pain, no obvious injury, just small signs that most people brush off as dry skin or tiredness. That mistake can cost someone their foot. Literally, over 37 million Americans have diabetes, and roughly 1 in 5 don't know it yet. And here's what makes that terrifying. Your feet show the damage first, long before any blood test catches it. Research published in Diabetes Care found that up to 34% of diabetic patients will develop a foot ulcer in their lifetime. And once that ulcer forms, about 20% of serious cases end in amputation. That's not a minor complication. That starts as something people ignore for months. In the next few minutes, we're going through all 5 warning signs with real studies behind every single one. But stay with me until sign number 1. Because a 2021 University of Miami study found it affects nearly 50% of all diabetes patients over their lifetime. And most of them had zero idea it was connected to their blood sugar. We'll get there. Let's start at number 5. Number 5. Dry, cracked, or peeling skin on the feet. This one looks so harmless that most people reach for a bottle of lotion and move on. But here's the thing. When your blood sugar is consistently high, your body starts losing the ability to properly control moisture in your skin. It's not just dehydration. It's a nerve issue. High glucose levels over time damage the small nerve fibers that control sweat glands in the feet. When those nerves stop working properly, your feet stop sweating. And skin that doesn't sweat becomes dry, rigid, and eventually starts to crack. A study published in the journal Diabetes and Metabolism Research and Reviews found that up to 82% of people with diabetic peripheral neuropathy, which is nerve damage caused by diabetes, had significant skin changes on their feet, including dryness and cracking, long before any painful symptoms appeared. That's 82%. And most of those people had no idea the dryness was anything more than a skin problem. The real danger isn't the dry skin itself. It's what happens when that skin cracks. Those small cracks, especially around the heels, become entry points for bacteria. And because diabetes also impairs your immune system's ability to fight infection, what would be a minor cut on a healthy person can spiral into a serious wound for someone with uncontrolled blood sugar. So what should you actually do about this? Moisturizing matters, but you need to do it right. Use a thick, urea-based cream, not just any body lotion, because urea actively helps the skin retain water and repairs the skin barrier. Apply it after showering, while the skin is still slightly damp to lock moisture in. Focus on the heels and the sides of the feet, but keep it away from between the toes, because moisture between the toes can cause fungal infections. Check your feet every single day in good lighting. Look for small cracks, peeling skin near the edges of the heel, and any areas that look inflamed or red around a crack. If a crack is deep enough to bleed, or if the surrounding skin is warm and swollen, that needs medical attention right away. Now let's move to a sign that goes one step further. If this is helpful, subscribe and hit the bell. We break down health science like this every week. Number 4. Changes in the color of your feet or toes. You've probably never stood there staring at your feet and thought that color doesn't look right. But doctors do, and they see it all the time in patients who are headed toward a diabetes diagnosis or already had one and didn't know it. Here's what's actually happening. Diabetes damages blood vessels over time. The medical term is peripheral arterial disease. Basically, the arteries that supply blood to your legs and feet start to narrow and harden. When blood flow drops in your feet, your skin color changes. It can go very pale or almost whitish when you raise your foot up, and then turn a deep red or bluish purple when you lower it back down. Some people notice their toes look bluish even at rest. Others notice one foot looks slightly darker or more red than the other. These are not random skin tone variations. These are signs of circulation problems. A large multicenter study conducted in Beijing and published in Frontiers in Endocrinology examined nearly 3,900 diabetes patients across 11 hospitals. The researchers found that 11.6% of patients had peripheral arterial disease, and the risk increased dramatically the longer someone had had diabetes or the higher their HbA1c levels. HbA1c is just a blood marker that reflects your average blood sugar over 3 months. People with HbA1c above 7% had significantly higher rates of circulation problems in their feet. What you want to do is a simple test at home. Lie down and lift your foot about 45 degrees for 1 minute. If your foot turns pale or white, then lower it and watch. If it slowly turns red or dusky over the next couple of minutes, that's a sign blood isn't flowing well. You can also press on your toenail until it turns white, then release. The color should return to pink within 2 seconds. If it takes longer, circulation may be compromised. These are things to report to a doctor immediately, not next month. Get your ankle brachial index, a simple painless test, checked if there's any concern. Up next is something that catches people completely off guard. Number 3. Slow healing cuts, blisters, or sores. Everyone gets a small cut or blister on their foot at some point. But for most people, it heals in a few days. For someone with diabetes, or on the path to it, it doesn't. It lingers. It looks the same a week later. Maybe it gets a little bigger instead of smaller. That's not just bad luck. That's your body telling you something is seriously wrong with the way your blood is working. High blood sugar creates a hostile environment for healing. It thickens the blood, reduces the ability of white blood cells to fight bacteria, and impairs the growth of new tissue. A landmark study published in the journal Medicina by researchers at the University of Miami found that impaired wound healing affects approximately 25% of all people with diabetes, meaning 1 in 4 people with diabetes struggle to heal properly, even from minor injuries. The research also found that high blood glucose promotes the formation of biofilms, essentially protective layers that bacteria build around themselves, which make diabetic wounds significantly harder to treat with antibiotics. So what looks like a simple blister can quietly become infected, and the infection can spread deep into tissue before there's even noticeable pain. Why no pain? Because the same nerve damage that causes dry skin also reduces the ability to feel it. The management here is absolutely critical. First, never pop a blister on a diabetic foot. Keep it covered with a clean bandage and check it every day. If a cut or blister is still open after 2 weeks, doesn't seem to be getting smaller, develops an odor, oozes fluid, or the skin around it turns red or warm, that's a wound that needs professional wound care, not just a bandage. Daily inspection with a hand mirror to see the soles and heels, even if you feel nothing, is essential. Keep nails trimmed straight across and avoid walking barefoot, even indoors, because undetected injuries happen constantly on feet with reduced sensation. That brings us to a sign that often sounds like something completely unrelated to diabetes. Number 2. Swelling in the feet and ankles, edema, swollen feet. Most people think, long day, too much salt, maybe I was on my feet too long. And sometimes that's true. But when the swelling is consistent, or it's worse in the mornings, or it keeps coming back with no clear reason, that's when it means something more. Diabetes causes swelling in the feet in more than one way. First, high blood sugar damages the tiny blood vessels called capillaries that are responsible for fluid balance in your tissues. When those vessels are damaged, fluid leaks out of them and pools in the tissues of your lower legs and feet. Second, diabetes significantly increases the risk of kidney disease, called diabetic nephropathy, and when the kidneys aren't filtering properly, the body holds on to extra fluid. That fluid heads south to the feet and ankles. A study published in the Journal of Diabetes and its complications followed patients over several years and found that even modest elevations in blood sugar, not full diabetes, just pre-diabetes, were associated with a measurable increase in fluid retention in the lower limbs. The inflammation triggered by excess blood glucose appears to impair how capillaries manage fluid, and this shows up in the feet well before it shows up anywhere else. To manage swelling, elevation is your first line of defense. Lie down and prop both feet up above heart level for 20 to 30 minutes, 2 to 3 times a day. This allows gravity to help drain the excess fluid. Compression socks, if your doctor approves, can also help prevent fluid from pooling. But the key here isn't just treating the swelling, it's understanding what's causing it. If you're swelling regularly and you're not sure why, that's a conversation that needs to happen with a doctor immediately, ideally with blood sugar and kidney function tests requested at the same time. And now, we've reached the most important sign of all. Number 1. Tingling, numbness, or burning sensation in the feet. Diabetic peripheral neuropathy. This is the big one. This is what doctors are most worried about. This is what the research calls diabetic peripheral neuropathy, and it is, by a wide margin, the most common, most dangerous, and most commonly ignored warning sign of diabetes in the feet. Here's the brutal truth. A comprehensive epidemiological review published in PLOS One found that diabetic peripheral neuropathy eventually affects nearly 50% of all people with diabetes during their lifetime. Half. And a separate study published in the journal Diabetes Care found that in the National Health and Nutrition Examination Survey, roughly 28.6% of people with diagnosed diabetes had not had their feet examined by a health professional in the past year, meaning the very sign that could catch serious complications early is being missed at scale. So what does it actually feel like? For some people, it's a tingling that starts in the toes and slowly works its way up, like the foot is asleep, except it won't wake up. For others, it's a burning sensation, like standing on hot pavement even when you're sitting still. For others, it's the opposite, a numbness, a lack of feeling that makes the foot feel thick or wrapped in something. And in many cases, the first sign isn't discomfort at all. It's stepping on something and not feeling it. Here's why this is so terrifying. The same nerve damage that causes the tingling and numbness also takes away pain, your body's warning alarm. A patient with severe neuropathy can develop a deep wound, a bone infection, even a gangrenous toe and feel nothing. This is how people end up with infections so severe that amputation becomes the only option. The CDC reports that about 60% of all non-traumatic lower limb amputations in the United States happen in people with diabetes, and neuropathy is the primary reason. The science behind it comes down to glucose. When blood sugar stays elevated over months and years, it damages the myelin sheath, the protective coating around nerve fibers, similar to the plastic insulation on an electrical wire. Once that coating is damaged, signals don't travel properly. The longest nerves in the body, the ones going all the way to your toes, are the first to suffer, which is why the feet are always affected first. What can you actually do? The first step is getting checked. A doctor can assess neuropathy with simple in-office tests. A tuning fork to check vibration sense, a monofilament, which is a small thin fiber pressed against different parts of your foot to check touch sensation. If you want to check at home, try this. Close your eyes and have someone touch different parts of your foot with a blunt object. If you can't feel it consistently, that's a red flag. Also notice if your feet feel different at different times of day, if the tingling is worse at night, or if you've noticed you're not reacting to hot and cold water on your feet normally. Managing neuropathy starts with blood sugar control. That's the foundation. A major clinical trial called the Diabetes Control and Complications Trial, run by the National Institutes of Health, found that intensive blood sugar management reduced the development of neuropathy by 60% in patients with type 1 diabetes. 60%. That number is remarkable. Alongside blood sugar control, regular foot exercise improves circulation to the nerves. Simple things like ankle circles, toe curls, and short walks daily. Vitamin B12 deficiency, which is common in people taking metformin for diabetes, also accelerates nerve damage, So getting your B12 levels checked is important. And regular daily foot inspections, every single day, without exception, are the non-negotiable standard of care for anyone who suspects neuropathy. So let's bring this all together. 5 signs, 5 chances your body gives you to catch something serious early. Dry, cracking skin, color changes in the feet, slow healing wounds, consistent swelling, and most critically, tingling, numbness, or burning that won't go away. None of these are just cosmetic. None of them are something to wait and see on. Your feet are one of the most reliable early warning systems your body has when it comes to blood sugar problems. And the research is crystal clear that the earlier you catch these signs, the better the outcome. A 2022 paper from Johns Hopkins found that early intervention in diabetic foot complications, meaning treating things before they became ulcers, reduced the risk of amputation dramatically. So here's what I want you to do right now. Take your shoes off. Look at your feet, check the color. Press on your toenails. Close your eyes and run a finger across the bottom. Can you feel it clearly? Check for cracks around your heels. Look at any sores or blisters you might have. And if something doesn't look right, or if any of these 5 signs rang a bell while you were watching, please get it checked. Not next month. Soon. Now, we want to hear from you. Have you ever noticed any of these signs on your feet? And which sign surprised you the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.